Today I'm going to be doing a trach care and suction. I'd first start off by coming in, introducing myself, check the patient's name and date of birth. I would then close the curtains, close the door, give them some proper privacy. I would then start doing some hand hygiene and putting on the necessary PPE. We would do the mask first. Throw this on. Throw on the goggles. Now I'm going to tell the patient what the procedure is going to be. The procedure is I'm going to ask you to take the lungs to make sure it sounds okay, and if I need to, if I hear any residue, then I'm going to do a suction. So I use the stethoscope. So there does need to be suction, so I let the doctor know and we would order the procedure. So to start off, I'll do my hand hygiene again. And we'll set up the field. The person will be on oxygen. So we'll need to set the oxygen between 10 to 15 and take it off. And if I have an assistant, my assistant will be making sure the patient can breathe as I set up everything else. I would then also, before I did that, I would get a clean pair of gloves. Make sure this is on about 150 millimolars of mercury. Test the suction, and then put it in a place. Now I'm gonna set up the first step. So you open this up, grab the box. I would pour the saline into the box. I would throw away the clean gloves, perform PPE, or hand hygiene, and then I will get my first sterile gloves together. I would just get a new pair of gloves because I just touched everything, but just for the sake of video. Now, get my catheter out. Wrap it up. Stick it in. Now I test it to make sure that it's sucking. Now the assistant would take off the oxygen. I'm gonna then stick the catheter into the saline, and I'm gonna keep my hand on the hole. I'm gonna stick it until I feel a little bit of resistance, and once I hit a resistance, I'm gonna circle and tap the hole as I suction it out. You should only have to do that about once. If you have to do it again, you take the bag, put it back on, and give them about three, you give them about 3 breaths, slowly. And then, still in. Then I would do it again if I have to. If I had to do the mouth, I would stick it back in saline and go circle around the mouth, but never go